Hello everyone! So for this video, I'm going to demonstrate to you how to use the different tapes in our PT management. Alright? Okay, so before we get started, again, I would like to distinguish the difference between these two types of tape. Okay, so this one is a rigid type of tape, meaning it is not stretchable. Okay, so it is fixed. And it is usually used to stabilize a specific joint. So if you don't want movement, you apply the rigid tape. Okay? Now, on the other hand, we have this type of tape, which is an elastic tape, okay, which can be applied directly on the muscle surface, and it will facilitate or inhibit a motion. So what does it mean? So it could either, for example, there is a joint hypomobility, meaning there is a joint limitation of motion. So you can apply the kinesio tape so that it would help its movement. Okay, so it will facilitate its movement. Now, if there is a hypermobility of a joint or a muscle, and you want to limit the motion but still perform the motion, then you can inhibit the muscle. Alright? So just for you to see, so this is the elastic tape. So as you can see, if I pull it outward or against each other, so ayan, okay, you can see the holes, meaning it is really stretchable. And if you would notice, I am not sure, yan, okay, if you could see the pattern, no, there are wave-like pattern on that, because once it's applied, it is not easily removed. Okay, so even if you take a bath, or even if, for example, for athletes, even if they sweat, there's a chance that it will stay, okay, on the joint or on the region, and it will not be easily removed. Okay, first let's demonstrate the rigid tape. Okay, so what I will show you is the thumb spica. So thumb spica meaning we want to stabilize the thumb. Okay, so specifically this joint of the thumb. Okay, so that it would be in a functional position, and it would lessen the movement of this joint. Okay, so usually we provide the thumb spica if there is pain on the thumb area or on this region. And for athletes, it's common. For example, for setters, they want this to be fixed so that it won't be difficult for them to perform the setting motion. Then you can provide or you can perform the thumb spica. Okay, so first we apply the anchor tape. Okay, so the anchor tape is just the layer tape where you can place multiple tapes, so just to keep it stable, no, or fixed. Okay, and then for rigid tape, the thing here is we don't use the scissors to cut it. Okay, so we tear the tape on its own. So sample na natin yan. Alright, so what we're going to do next is to apply a half size tape. Okay, a half size tape for our thumb, no? Kasi this one is thicker, so we want just a thinner type of tape. So, no, you should know the landmarks when you are applying the tape, okay? So, for example, it has to be coming from this area, okay? And then, you go around the joint itself while keeping it in this position. Alright. And then, you go down to this side and end at the same side of the starting point. Okay? So, dito din siya mag-end. So, let me put in more layers for us to cover this bone. Okay? So, as you can see, medyo limited na yung movement ko. So, comparing to this side, I can, of course, close my hand like this. For this side, it is limited because I have already fixed the joint, no? It is less moving. After you perform the 3 layers, you have to keep it in place. So, we will also again apply a lock. Okay, so meaning one thick Mueller tape to keep it in place. Okay. Alright, so there you have it, no? So it's fixed, it's not moving, so mas stabilize na natin yung thumb joint natin. So this is the thumb spica. So this time, we're going to use the Kinesio tape, no? Or the elastic tape to apply it on my wrist. So again, for example, to facilitate the movement of my wrist, okay? Again, I have weakness in my wrist extension, so I have difficulty in performing this motion. And I want to facilitate the movement, so I can perform it, pero I have difficulty or I have limited motion. So I want to use the tape to facilitate motion because the pull of the tape will help pull the muscle, okay, towards its attachment, okay? You have to know the attachment so that you can actually measure the length of the muscle kasi the length of the muscle will be equivalent to the length of the tape, okay? So, for example, wrist extensor muscle, so the attachment, diba, sabi nga natin, it's from the elbow to the hand. So, ngayon, paano natin siya gagawin? So, you have to perform it in the stretch position of the muscle. Okay? So, if this is the motion that we're looking for, this is the stretch position, meaning the opposite position. Okay? And then, try to measure it from the elbow, no, to the wrist. Okay? So, ayan, that's the length up to here. Okay? If this is the real length of the tape, so we fold it into 4. Okay? And magtatanggal tayo ng 1/4. And that is where we cut the tape. Okay? So, now, once you cut the tape, what we do here is we round the edges. Okay? We round the edges of the tape. Bakit po? Because once we round the edges of the tape, it will be difficult. It will not. It will be harder for it to peel off. Okay, so once you have cut your tape na rounded edges siya, so what we do is we also have anchor tapes. Okay, so meaning yung dulo, the end portion of the tape is considered as an anchor. Meaning you don't have a pull on that portion kasi you just want to keep it in place on the landmark na paglalagyan mo ng tape, okay? So, for example, ayan, let's like slightly cut the piece of the tape. Now, if my landmark is in here, in the lateral epicondyle, then I have to place the anchor in there, and then we'll pull, and then apply it on the opposite anchor, okay? Okay, and then in the stretch position, apply the anchor. Okay, just stick it there. Okay. Ayan. And then the next portion is to actually remove the rest of the paper, no? So, once you remove the piece of paper, eto, natanggal na natin siya. Okay, you just have to pull, slightly pull the tape so that you can get the stretch position, okay? Or stretch yung flow ng tape. And then, okay, once you have that enough length for the stretch position, okay, you can attach the final anchor. So, yan. And then, you just have to stick everything. Yan. Right? For it to stick more, no, para hindi siya agad matanggal, is you apply friction on it and it will stick there. Okay? For at least 1 day or 2 days, pwede yan. Okay? So, that's the reason why you can play with it. You can take a bath with it. Okay? But of course, for hygienic purposes, we don't want to encourage it na you keep it there. Once it's already itchy or once it's already dirty, you can, of course, opt to replace it naman. Okay? But basically, of course, you cannot feel it, no? Pero I can feel that there is a pull of the tape on my muscle. Okay? So, basically, that's how you apply the Kinesio or like the elastic tape. Okay? So, yun na.